Hi, welcome to another episode of Hot Takes. Remember how Labour always said that it would be the Tories are going to privatise the NHS? And the Tories always said, we've got no plans to privatise the NHS. Well, it turns out that in order to try and shorten the waiting list from 18 months, which is terrible, to 18 weeks, which is terrible, Starmer is going to privatise the NHS. Yes, who'd have thought it, eh? Labour bringing in private companies to make the NHS work. After all those years of saying it was going to be the Tories. Oh, the hypocritical, two-faced lying twonks. But that's what it is. He said the NHS cannot keep ducking reform. That'd make a change, wouldn't it? They're reforming it every 10 minutes. Every time a new minister comes in, it gets changed. That's why nothing works, he says. And it cannot remain a national money pit. No, it can't. But it's easy. Line up every manager, tell them to pick a random number, and if it's an odd number, fire them, and if it's an even number, fire half of them. And then you say, look, here's how it's going to work. The rest of you managers who want to keep your jobs will make the NHS work. And we don't mean counting paper clips. We mean actual real savings. Get rid of the shite. Stop painting rainbows everywhere. Just everything becomes white, right? Buy a bulk load of white paint. When it wants painting, white paint. Done. And get rid of all the extraneous bullshit. Let's not have diversity officers on £130,000 a year. Let's hire 3 nurses for the same money. You get the drift. And so the money can be saved, the throughput can be increased. And once you get a higher throughput, let's get rid of this bullshit idea that it takes 18 weeks to go to hospital, and let's turn it into what they do in the private sector. Oh, would you like to come in on Thursday? Sure, no problem. And in you go. You get your thing done and you're out. If they can do it in the private sector, why can't they do it in the public sector? It's because too many people have got too many thumbs in too many pies and they all want to feel important. It's all little fiefdoms, isn't it? Oh, this is my responsibility. That's that responsibility. Get rid of that shit. Privatise the entire NHS and give everybody their national insurance card. And then you go and do it. And how would you like to be paying today, sir? Cash, card, private insurance or national insurance? And at that moment, of course, you're going to get rid of all the foreigners who won't be coming over here to pay cash to use our facilities. That alone would free up maybe 20% of NHS beds. Yes, that many. There's that many foreigners coming to this country just to use our facilities that we are paying tax for. Here's the thing as well. If you do it that way, then you can opt out and save an absolute fortune. If you are private, then you get better things. If you are just national insurance, you get the same treatment, but maybe you don't get as nice a bed or as good a selection of food. But you're on the same list, and that's the point. Push it through and make it work. Make the NHS as efficient as private medicine. But of course, nobody wants to say that, because the moment you do that, you're going, oh, but that's racist. Why? Because foreigners coming over here won't be able to get use of our facilities. Yeah, well, there's a simple answer for that, isn't it? Fuck right off home. Go home. Use your own. There's no point coming to Britain for them. We haven't got the room. If you want to use our facilities, fine. Pay up. Honestly, you need a woman, a very strict, brusque secretary type, sitting at the door of every hospital. And how will Sir be paying for his treatment today? And then you watch them turn around and sadly walk away thinking, Britain's no longer a soft touch. Job's a good one, isn't it? But also, the throughput will be at the rate of private medicine. You won't be waiting 18 months or 18 weeks. You'll be waiting 18 hours. No shit. I had a problem with my eye several years ago. I couldn't get a doctor's appointment, a GP appointment, for about 2 weeks, by which time he would have then signed me up to go and see a consultant, which would have been another 10 to 12 weeks. And I thought, you know what? This is my damn eye. No, I phoned up. I went private. I got seen within 24 hours in Harley Street. And it only cost me £300. Now, yes, I was fortunate enough I had £300. Let me tell you, that went on the credit card. But even so, we're talking about my eyes. And I got seen within 24 hours. If private medicine can do it, surely the state can do it. Just adopt the same practices and stop Johnny Foreigner taking up all the room. It's not hard. It really isn't hard. But of course, it's not going to happen. And of course, if you did that, you'd see a massive uplift in productivity. Because at the moment, there's nothing for a hospital saying, oh, well, if we you get a bit more staff, we can put a few more people through. It doesn't matter. Because the doctors aren't going to get paid anymore. The hospital managers aren't going to get paid anymore. They're all a fixed salary. Doesn't matter if one person gets seen or 100 do. There we go. Do it on a private medicine basis and bang, let me tell you, they'll be hiring a few more nurses. They'll be wanting those beds cleared as quick as possible. They'll be wanting to see more and more people because the more people you hire as staff, the more people you can see through the door. Ka-ching. Waiting lists down to days, not months. Why can't they see this? And of course you're going to go, oh yes, but health service. Yes, but here's the thing. Your national insurance card counts as your health insurance card. You go to hospital with your national health insurance card. They put it in the machine. You're paid up. Jolly good. In you go. And anyone under, say, 16, automatically paid for by the state. So children, fine. Absolutely. No issue. Still paid for. National insurance. Why not? Why not? It's because they're scared. It's because they go, oh no, we set this up. It's Labour, wasn't it? Labour set it up. And they go, oh no, we can't break this. And here they are. Starmer, bringing in private companies, finally realising the truth. Private sector, much more efficient than public sector. Always has been, always will be, because it isn't bloated. Everybody's got a job. Everybody does their job. And if they don't do their job, they're down the road. You don't get that in the public sector. Finally catching up, are they? There we go. Let's do that. Let us finally grasp the nettle and privatise the NHS system, but have public NHS cards. Everyone wins. Will it happen? Will it buggery? This is the Labour Party. I bet even the implementation of the private sector thing will have to have ministers putting their little grubby fingers all over it. Oh, you can't do that. You can't do that. And then the private sector will probably walk away going, look, either let's do this or piss off. And then they can't help themselves. Anyway, let me know what you think. Thanks a lot. Take care. Bye.